You for taking time to be here this morning. So I'll please request that we be on our feet as we take the national prayer.
Nigeria, we hail thee, our own dear native land. Though tribe and tongue may differ, in brotherhood we stand. Nigerians old and proud to serve our sovereign fatherland.
Thank you. Please, you can have your seat. So before we go into the opening remark, which is to be done by the National President, the Joint National Association of Persons with Disability, I would like us to take a brief introduction to some of us. We've been here before when we had the two-day conference on disability inclusive and response and referral system in Abuja here. That was last year, September. But this time we expanded the group to a national level activity to ensure that our strategic outcome is actually addressing the issue of inclusion for women and girls with disability when it comes to GBV response and referral. So before we take the opening remark by our national president, I would like to pass the microphone round the room so that we can introduce ourselves. You tell us your name, tell us your organization. If you are from out of Abuja, you tell us your state, and you tell us the food you like best. Maybe that will also influence our lunch this afternoon. So let me start with myself. My name is Bukumi Adejumo. I work with the Joint National Association of Persons with Disability as the Program and Communication Officer. The food I like best is amala and abula, which is begiri and ewedu from the southwest. Thank you. So please let me pass the microphone. Thank you.
Good morning, everyone. My name is Ellen Beyo Kwalashe. I work with Deaf Women Aloud Initiative. I'm from Abuja here. My best food, okay, let me think of it. And I think any food. Thank you very much.
Good morning, everyone. My name is Adebayo Idou Omeza from Hope Alive for Possibilities Initiative, admin officer. And the food I like most is pounded yam with begiri. Thank you.
Good morning, everyone. My name is Agesopa Isaac Onyatibo. I'm from Hope Alive for Possibilities Initiative. My best food is roasted yam and I don't know.
Good morning, all. My name is Nasir Ahmad Garko. I am the Center Manager, Waraka Sexual Assault Referral Center from Kano State. My favorite food is rice and beans.
Good morning, all. My name is Hope Jime from Hope Alive Foundation. I'm the Child Protection Officer of that organization. From Kogi State. My favorite food is amala and fresh fish. Thank you.
Good morning, all. My name is Linda Ene Dirisu. I'm from Benue State. I coordinate the Benue State Sexual Assault Referral Center. My best meal will be pounded yam and okoho soup. Thank you. You don't know okoho? It's my native soup. Thank you.
Good morning, all. I am Nana Kundam I am the center manager for Salama Sexual Assault Referral Center, Kakuri, in Kaduna State. And my favorite food is rice swallow and granite soup.
Good morning, everyone. My name is Zainab Alaka, and I'm the Programs Officer at Lagos State Domestic and Sexual Violence Agency in Lagos State. My favorite food is fried rice and fish.
Good morning, everyone. My name is Adedoyin Emmanuelson from Chechera Child Advocacy Center, Center Coordinator for Abuja branch. My best food is Yamarita.
Good morning, everyone. My name is Augustina Nwanfo. I work with Chechera Child Advocacy Center as their legal officer. Okay, I'm from Rivers State, and my favorite food is white rice and stew.
Good morning, all. My name is Umar Farouk. I work as a social worker at Chechera Child Advocacy Center. My best food is pounded yam and egusi soup.
Good morning, everyone. I'm Obele Monica from Kuje General Hospital. My favorite food, yam and beans.
Simple. Good morning, everyone. I'm Pastor Deborah Laiva Legbemi, State Coordinator, Queens FCT. My favorite food is amalang begiri with a wedu that Bukumi mentioned. Thank you.
Good morning, everyone. My name is Dr. Chinemeremi Wanyawu. I'm the country director for Secure the Future International Initiative. I'm an Igbo woman, and my favorite food is abata.
Good morning, everyone. My name is Joshua Akachukwu. I'm the Operations Officer, Secure the Future International Initiative. I'm from Enugu State. My favorite food has to be no. She said okpa. No, but my favorite food has to be all kinds of porridge. Porridge beans, porridge yam, porridge potatoes. That's my favorite. Thank you.
Good morning, all. My name is Femi Oyatolu from Oyo State, Nigeria Security and Civil Defense Corps officer. My favorite food is amalan and ewedu. Thank you.
Good morning, everyone. My name is Teresa Monde from the Gender Unit of the State CID FCT Police Command. My favorite food is pounded yam and okoho. I have a sister here.
Good morning, everyone. My name is Alagi Yunis from PWD Unit, Nigeria Security and Civil Defense Corps, FCT Command. My favorite food is yam, boiled yam.
Good morning, everyone. My name is Blessing Obi. I work with Global Rights. I'm the program assistant of the Gender Unit. My favorite food is anything yam at all. Yeah.
Good morning, everyone. My name is Murjana Tukamaldeen. I'm the head of programs at Safe Haven Foundation. My favorite food has to be moi moi.
Good morning, my respected brothers and sisters. Peace be upon you all. I am Zaina Mustafa. I'm the National Woman Leader of Joint National Association of Persons with Disability. Thank you. I'm from Plateau State, and I eat anything that is available. Thank you.
Okay, thank you so much. Somebody's just coming in. Maybe we can pass the mic to her.
Okay. Good morning, everyone. My name is Mrs. Kuma from NAPTIP, and I'm from Benue State. You know my favorite right now, pounded yam as usual, and fruits. Thank you.
Good morning, everyone. Bisi Ajayi Kayode. I'm the CEO of the Chechera Child Advocacy Center.
an NGO that helps children that have been sexually abused or at risk and their non-offending families with the provision of one-stop response services, a toll-free child helpline, free legal, medical, psychosocial, shelter services, forensic interview, and awareness prevention training. At Chichiara, we are child-focused. Every child is important, and we operate an inclusive program, especially for children living with disabilities, so that they can access justice, because they are even more vulnerable to all these abuses. Thank you. My best food, I'm an Ijesha girl from Osun, so pounded yam, good vegetable soup.
Okay, thank you very much. I also have my colleagues in the room, and I would like them to introduce themselves.
Morning, everyone. My name is Tunde. I work with the secretary. My best food, Gary and granite.
Good morning, all. My name is Usman Umaru. I work with the National Secretariat. My best food is rice, as usual.
Good morning, everyone. My name is Uche Garuba from the National Human Rights Commission. My best meal is white rice. Thank you.
Thank you.
Good morning, everyone. My name is Aviaki, JONAPWD FCT woman leader. My best food, pounded yam and pocho. I'm from Benue.
Good morning, everyone. My name is Moyolua Adeshewu, and I work with the JONAPWD Secretariat. Thank you. Amala, ewedu, and begiri with assorted meat.
Good morning, everyone. My name is Zainab Yahaya. I work with the National Secretariat. My favorite is jollof rice and goat meat.
Okay, thank you so much, everyone, and welcome once again. So I would like to assure you that all of this favorite meal that we just mentioned, we will see them during the lunch period. Please feel free to take as much as possible. Thank you. As we were doing the introduction, the national president, the father of the disability community, just walked in, and I'm going to be passing the mic to him to introduce himself and at the same time also do the opening remark for this one-day national workshop on disability inclusive and survivor-centered gender-based violence response and referral system. Thank you, sir.
Thank you so very much, and good morning all. I am Abdullahi Ali Usman by name, and I am the chief servant of disabled community of Nigeria. Good morning once again. As she rightly mentioned, and each and every one of us has already known that we are here for a one-day workshop, or I would say one-day sensitization. We want to sensitize ourselves to know the best thing we will do based on the gender-based violence. So I only want to tell you that the workshop, the caliber of people I see here, I know almost all of you are experts, and we just want to come here so that we brainwash ourselves. We collectively discuss the very important issue we will use to protect ourselves, to protect the members of our community. I really appreciate you by honoring our invitation and be here, and I wish us, each and every one of us, to give a meaningful contribution to see the progress of this workshop. I also want to a situation whereby when we live there, what we deliberate, what will be discussed, will be implemented in our various places so that it will benefit the disabled community of Nigeria. Thank you, and I wish us a very successful workshop. Thank you once again.
Can we please jam our hands together? Thank you so much, sir, for the wonderful opening remark. Right now, we go into the workshop objectives and expectation. I know we have all read through the agenda that was sent to our emails, and the purpose of this workshop was actually because in September last year, we had a two-day conference where we have referral centers from Lagos and Abuja come together to discuss their interventions for persons with disabilities. And during the workshop, our notion earlier was that centers are not accessible. But then we also got to realize that most of the centers does not even know how to make intervention, how to respond to GBV cases for women and girls with disabilities. And after the workshop, we had an accessibility audit for some facilities in Lagos and Abuja. And this is a training coming up based on the gaps identified during the accessibility audit to build the capacity of referral centers. But then now it's an expanded work, which has to do with some of the other states that were not audited during the accessibility audit. And the purpose is for us to ensure that we are addressing systemic, attitudinal, structural barriers within the GBV system and ensure we have a coordinated, right-based response. During the conference last year, September, we also had a group of all referral centers that were present to say, okay, when we have cases of GBV against women and girls with disability, we can quickly call on the group to be able to respond, because we understood that, yes, the facilities are not holistically accessible. But wherever gaps are identified in one facility, we could see another facility that can help in making response or giving response to the GBV cases that we have at hand. And we wanted to, like my boss said, the father of the community said, we have experts in the room. We are just here to discuss and ensure that, yes, we are experts, but then our responses are actually inclusive to women and girls with disability. And I will be presenting the findings from the accessibility audit. I know that I have shared the report earlier, so I am not going to do a complete presentation, but I'm just going to walk through it and give us room to validate the findings and also give our reflections. And specifically for the unaudited states that we have in the room, we are also going to listen to them, listen to their key reflections on their interventions to women and girls with disabilities. Please, sir. The slide. Okay, so like I said earlier, this accessibility audit came up as a result of the conference we had in September last year. And we visited some facilities in FCT and in Lagos. This is a group picture of the, from the conference. So we visited some facilities in Lagos and Abuja to assess their facilities. And the purpose of the accessibility audit was not to criticize any organization that you're doing well or you're not doing well, but we just wanted to identify gap and support such organizations to improve in responding to GBV cases when it comes to women and girls with disability. And from the audit that we did, we saw that the facilities externally is actually accessible, but then there are weak points within the facilities. Some features within the facilities are not accessible to women and girls with disability. So majority of the facilities at their entrance lead 80%. Most of them you can access right from outside the facilities. But then getting to the premises, you realize that there are some routes that are not accessible to wheelchair users. There are no tactile pavings. There are no audio description for persons that are deaf. Many facilities have no sign language interpreters. There are no alarm systems that respond to different impairments. And then some of the facilities are actually a story building, two-story buildings, staircase, no ramps, no lifts. And when it comes to the bathroom, which is often forgotten when it comes to checking accessibility for women and girls with disability, we realize that most of the bathrooms are without, they do not meet accessibility standards. They don't have any accessibility features. Only 20% of the bathrooms that we audited, both in Lagos and Abuja, actually had grab bars, handrails, grab bars within the toilet. Only 20% out of all of the facilities that were audited. And the meeting rooms, the communication, most of the facilities that we audited actually, some take cognizance of accessible communications, but they were not specifically meant for persons with disability. So from the audit, we realized that some organizations that actually use closed captioning were doing it because they were posting online, they are using videos, they were not specifically targeting women and girls with disabilities. And for facilities that has examination room that provide health services, most of their beds are not adjustable. There are no space enough for wheelchair users to maneuver. And for the structures, a lot of the structures are actually not on their permanent site, and modification was actually made difficult for some of those structures. Though we got confirmation from some of the facilities giving us assurance that yes, though this place is not our permanent place, but then we also have room for improvements. We are looking to expand, and we will also take accessibility into cognizance while doing the expansion. This will not come out. This is a graph showing all of the features that we got from the room, and these are quotes from some of our respondents during the accessibility audit. Some says, yes, we focus on what we say, where we say it, who we say it to, and how we say it. And this was actually because of the target audience they are responding to, not because they are actually conscious of inclusion of women and girls with disability. We also have some quotes like, we ensure that our content is easy to understand, easy to read, and uses appropriate and plain languages. Identification and mobilization of persons with disabilities are difficult during outreach and prevention intervention. We are willing to learn sign language, and we are open to remodification and hopeful to secure technical support from JONAPWD. These are some of the quotes that we got during the accessibility audit, and it was actually interesting that we have people willing to include persons with disabilities. And these are just pictures of what we call an accessible ramp. So, like I said, I don't want to go deep. There are some facilities that we audited. There are ramps, but they do not meet the accessibility standards. So we have some ramps created already that also need remodification. So this is an accessible ramp with tactile paving. This is an example of a parking space designated for persons with disability, and we can see that it's very close to the building. So it's easy for a person with disability, most especially a wheelchair user, to come down from the car after parking and access the building without stress. And then this is an example of an accessible toilet. These are grab bars and handrails within the toilet that would make it easy for a wheelchair user to transfer from the wheelchair to the toilet closet without any support, without any barriers. And this is an example of a calming room, specifically for persons with psychosocial disability, intellectual disability, in a facility where you have cases of GBV and you're responding to such cases. And then after a while, a person with psychosocial intellectual disability will need a place to actually relax, cool off from all of the conversations. So this is an ambience where a person with psychosocial or intellectual disability can actually cool off and relax. And these are some of the recommendations that we came up with from the accessibility audit. We looked at the facility holistically, and it was identified that the physical accessibility was actually not up to the minimum standard. So we'll talk about installing ramp, widening the entrance. Some of the facilities had their entrance door very narrow, which is not accessible to a wheelchair user. We have ramps that has one-sided handrail, or ramps without handrail, which is injurious. And then we also recommend that we ensure that our pathway to the facilities are actually clear of obstacles to ensure free movement for persons with disabilities. And then we also make recommendation about enhancing the internal access, providing accessible doors, maneuvering spaces. I could remember one of the facilities that we visited. We have different obstacles around in the room, and then we were discussing and we were like, so all of these obstacles will actually prevent a person with disability from moving freely within these facilities. And the person responded that, no, we will just shift it. We actually wanted it in a way that it's easy without anybody around. A person with disability can have independent and free movement around the facilities. There are recommendations about upgrading the toilet, improving the services, strengthening information and communication systems. So the use of captioning, use of plain text because of the diverse impairments that we have within the disability community, use of large prints and audio format and braille would help us pass the information clearly and accurately to women and girls with disability. Then we also need to train our staff on accessible, inclusive communication, train staff on accessibility. And then we also need to strengthen our emergency preparedness, because most of the facilities also, though within the facilities there were no emergency plan specifically from the facilities, but they collaborate with other facilities to ensure that this is being addressed. Then we also have recommendation about building staff capacity, and some of the codes also already highlighted that the willingness on the part of the facilities to ensure that there is inclusiveness, women and girls with disability actually accessing services and enjoying each free referral. So thank you very much. I would leave the floor open. I'll leave the floor open for us to actually validate this finding. That's for those that were in Lagos and Abuja. For the facilities that we have in Lagos and Abuja, do we have any comments, any questions, any clarification? Any question within the room? Okay.
Well done, thank you so much. No question but commendation well done for a good job, well done. The realities are well expressed in the report. And I just want to thank JONAPWD for this awesome work that is going to deliver great results in this country. Thank you.
Good morning, everyone, once again. My name is Kuma Theresa from NAPTIP. I want to say you did a beautiful work, and I just want to recommend that in handling SGBV with Disability Commission, I think other actors need to be trained. Like we have the police, we have the civil defense and other stakeholders. They need to be trained in line with the VAP Act. Sometimes people find it very difficult to, like the caregivers find it very difficult to understand. Somebody is being abused, and when it gets to you, you start asking some unnecessary questions, trying to re-traumatize the person again by saying, are you a child? Why did you expose yourself? People need, in your work, you need to have a capacity building for people, for stakeholders, in line with the VAP Act, so that people understand what disability and SGBV needs to be done, or how it is being treated or handled or understood in our society. Thank you.
I would like to start by commending JONAPWD, because unless you come to gatherings like this, you never know the magnitude of the problem. For persons living with disabilities, when you don't have access to the basic needs that can bridge the gap for you, it can be quite traumatizing. But I strongly suggest for NGOs like Chichiera, all these recommendations, if they can be shared with us, because oftentimes, because of the evolving dynamics of the abuse of persons living with disability, you never know when you will need what. I remember a specific time we are trying to interview a 14-year-old girl that was serially molested, defiled by the uncle. She had hearing impairment and living with the disability of hearing impairment and all that. So when she's trying to do the sign language to tell people what has happened, people were thinking of outsiders. She was being misunderstood. And when we tried conducting forensic interview for her, it was as though she was not cooperating. We now discovered that she had another disability, which was epilepsy. And because of the trauma of serial, I'm talking of being defiled by the uncle for about 3-4 years non-stop before people got to know. So we had to seek medical help for her. And the doctor's advice was, in as much as law enforcement, NGOs were trying to help her, for now, she has never received proper medical treatment, that she just needs to be in a safe atmosphere to rest, where she'll be sleeping, not seeing too many people, not being interrogated. And this was a case that gone viral in the community, and she was being ostracized. She had to be relocated. So we thank you, but to make what we are trying to do to have maximum impact, let us disseminate all this. For example, I learned something now, apart from preventing slippery grounds for persons. We need to, our restrooms need to be readjusted, and for NGOs like ours, we learn something, we make everything child friendly. So if a mother has a physical challenge and is bringing a child to us, we should make our restrooms very comfortable, because if she's the one to take the child to the restroom. Thank you very much.
Good morning once again, and I want to commend JONAPWD for a job well done so far. We have been hearing about safe homes, and nobody really took it upon themselves to go to these safe homes and visit and know exactly what is happening there and what is obtainable there. So for JONAPWD being our father NGO and taking it upon themselves to do this job. We are grateful for them. It's a very good initiative, and I commend the homes that are existing already for a job well done. So going through the report that was sent to all of us, I noticed that one thing came up prominently, which is the entrance of such homes. There were no signages and signposts to know that, okay, such a home exists here. So I've been wondering in my head, is there something that have prevented these homes to have a bold signpost that, okay, such a home exists here? I would really want to know, because cases of gender-based violence and survivors has been in existence for some time, and a lot of NGOs permit me to just use the word, we are making noise about it. So if shelter homes are being in existence and we are not having bold signposts to make people know that, okay, we exist here, we are taking such cases and all, how do people get to know? And we are always in the rooms here talking about it. So if there's something that is preventing the homes to be boldly written that, okay, we are here, this is a signpost, because a lot of when you are going somewhere, you first of all identify that place with a signpost. So I really want to know if there is something that is preventing that.
Good morning, all. My name is Ima Bongladikwa Sanusi. I'm wearing a pink and black top and trouser. I'm 5 feet plus. I want to thank JONAPWD for this insight and insightful and impactful document and also gathering. And sister, thank you for your question. It means we are here to rub minds. Number one, homes should never have signages. That is, for us at Women Trafficking and Child Labor Eradication Foundation, we are into counter-trafficking, migration, child labor, and gender-based violence. Because of the peculiarity of the issues around victimology, it is absolutely not necessary to put a signage. And because of the fact that traffickers, abusers, and perpetrators always go after victims, there is no need to be signage. You just need a serene and secured environment. Otherwise, like I always say, it is not like property and property services that you have to put a big billboard. If you have something to do, and through referral pathways, you get to know the location of that home. So once again, let me say thank you to JONAPWD. Your report has really helped us to learn rather than shame anybody. Thank you for everything you do. Best wishes all.
Good morning, everyone. Thank you to JONAPWD for a job well done. It's wonderful from the report we have got. I wanted to talk about the shelter house. From the finding, it was so clear, and from the follow-up that we have seen, so that's some of the audits that we do on the shelter house. Have some at DY, when it comes to this issue of GBV and the shelter house, you know that some of the victims that have reported on violence, and we keep those victims in the shelter house. Most of the organizations that have a shelter house that you mentioned that they are not accessible from the audits that you carry out, we have some example of some deaf people who are being violated, raped, and they contact some shelter house. Sometimes they ask, maybe we just give these deaf people hearing aid because there's no any provision for them to be able to communicate with them. So when we keep them with us. So these are some of the areas when it comes to GBV in the audit that we carry out, that we also have to build some capacity of the responders about the bed, the security of the victim, and what's the best way when it comes to the person with disability at the shelter home. These are some of the things we also have to look into, how the security of them, because when it comes to the victim that have to do with person with disability, from being prevent them from the abuse. So we have to look at it deeply. These are some of the recommendations we are finding out, so look at it. The shelter home, what are the government do about it? How accessible are they related to our work? Thank you very much.
Okay, so Madam Ellen, if I get you clearly, you're trying to say that though the accessibility audit has been done, but then we also need to do accessibility audit of government shelter homes. That government shelter homes are not accessible. Okay, so she's actually making a recommendation on looking at government homes, shelter homes that actually belongs to government, to prevent re-victimization of victims, right? All right, thank you.
Good morning, everyone. Let me just lend my voice in commending JONAPWD for this well-conducted research, and also the intervention they are doing to ensure accessibility when it comes to intervention on GBV, especially for women and girls with disabilities. Just wanted to also add to what my sister Ave raised on the issue, and I think why she raised that question is just the issue of information. How do we know about the existence of these houses? Signages, I agree with you 100%, are not necessary, because some of the survivors also need protection. And once the perpetrators can even get a clue of such facilities, who knows what will happen again, the issue of re-victimization. But there is also the importance of having information about the existence of these houses. For instance, we talk about referral. If our organization are in contact, because organizations of persons with disabilities may somehow be the first point of call when some of these violations happen, how do we get to know the right places? So there should be a way of publicity without necessarily having signages. There should be, for instance, JONAPWD having the list of these houses, circulating it and sharing it. If I call Ave today or call any other person, they should be able to connect me. Personally, I will tell you that if someone called me about that, even as I sit here now, it may be difficult to point a place. So information regarding this is very vital, and will depend on JONAPWD to provide this by the end of this meeting. Thank you.
Thank you so much. From what my sister here has just finished saying about the information, I really want to appreciate the JONAPWD Secretariat for bringing out these particular issues and for their hard work. And I want to talk about, even though all the stakeholders are here, but we need to amplify our voices, and also paying some advocacy visit to maybe the office of the head of service, in order to bring out the points, maybe to remove some of the policies that talk about the accessibility of persons with disability, because most of them they will be acting ignorant. But with the policy, I think it will go a long way. Thank you so much.
Okay, I think that's the last person, right? All right, thank you so much, everyone. I would respond to a few of the comments, questions that were raised. Somebody spoke about some specific stakeholder. Yes, ma'am, that was supposed to be in the room. So I can assure you that they are here in the room. We have the Women Affairs, we have NAPTIP, we have the NSCDC, we have Legal Aid, we have FIDA, all present. And they were all invited to be part of this training. And then also for sharing of information, I think that earlier when I started the presentation, I said during the last conference we had in September, we also have a group that we created which we are pushing to be better. Yeah, we have a coalition of GBV responders, disability inclusive GBV responders, and we have a WhatsApp group where we share information. So I can also try to expand the group to ensure that we are all well informed about that. So thank you very much, everyone, for your comments and contribution. Thank you very much for your comments and contribution. I would like to go to those unaudited states that are present in the room to give us their key reflection in no order, but I'm going to go by what I have on the agenda. So I'm going to be calling on Benue State. So the representative of the center, Benue State Sexual Assault Referral Center, please, you can go ahead. Thank you.
Okay, thank you very much. Don't know if I should stand. My name is Linda once again from the Benue State Sexual Assault Referral Center. I'm the coordinator of the center. We're happy to be in this room. We were not opportune to be here last year. What we do at the center is to care for survivors of gender-based violence, ranging from rape, child abuse, domestic violence. But of course, we don't work alone. We work in collaboration with Ministry of Justice, the police. We work with Ministry of Health. We work with NAPTIP. We work with FIDA. And of course, we're a referral center. Issues of persons living with disability, we're not there yet, but of course we have survivors who come with reports as to being abused sexually. Presently, I'm handling a case of okay, I won't mention name, and I don't know. I also don't want to mention the organization, but of course, it's an abuse on a girl, an adolescent girl, who went for a job interview in Benue State, and she was lured in and sexually assaulted. The case is in court. Even just this morning, I still got feedback from the staff of the center as to how the case is going. So for the Benue State sexual assault, we have a ramp that makes accessibility easy. We also take very importantly issues of GBV with survivors who are physically impaired one way or the other. And for us at the center, most times when we go to court, we find it very difficult to get sign language interpreters. Mostly we'll have to start looking for them, and when we look for them, they tell us you have to pay us before we appear. So I don't know if that's how it's done, but that has been a challenge for us. For me, maybe after here, if there is no body that makes it easy for survivors to access these persons, I think we should make it happen. I'm always of the opinion that we are there to make access to justice, access to health, access to healing very easy for these survivors. So when they come and they have to start paying for these services, it becomes very, it's more hurting. I'm not sure it will help their healing. And then we also, maybe with time, speaking about the shelter homes, once we have a well-structured referral pathway, it makes it easy for us to access these homes. There's a way we operate as professionals in this field. It's either we have one platform where we know ourselves or the other for easy access to what. So the referral pathway needs to be strengthened, and we should have a more holistic referral pathway that people, actors around, GBV actors should be aware of. Is one thing for that to exist, is another thing for accessibility. Most people don't, even the major actors don't even know if there's anything called a referral pathway. So if it's a coordination meeting for we to know that for you to get this, you contact this person, we'll just have this information handy. So basically, that's it with Benue State. Thank you very much.
Thank you very much, ma'am. Okay, so I'll move to Kogi.
Good morning, everyone.
Good morning.
Please permit me to sit. My name is Hope Jime. I'm from Hope Alive Foundation. In our case, we empower people with disability, and we make sure that they have we give them training, especially girls and women. We work mostly with girls and women, and we are a GBV organization. That's what we do mostly, disabilities. We are not into it very well yet, but we are working towards that. We don't get to see them coming to our place for reporting and all that, but they are always welcome to report cases like that. We handle things like rape, and the last time, I won't be mentioning names, but a little girl was raped and she was traumatized. She was in a school where they were now referring to her as the wife of the rapist. She was being called Madam that person. So a case came to us and we went to the school. She was removed from that school to another school. So about people with disability, I'll say they are also human. They have blood running in their veins. They are supposed to be like normal people, but they are being maltreated in other places. There are places where you go and they said, this place is not for you, it's for somebody. They are limited in the society. So we are working on that. And we give scholarships. We work with state governments. We work with the police. We work with the communities, people who work in the communities. they report cases to us and we make sure they are well solved. We thank you so much for organizing this and bringing us to join you. We look forward to working with you. You can always reach us whenever the need be. Thank you so much.
All right, thank you very much. I would like to call on Niger State, sorry. Is here.
Good morning, everyone. I'm Muhammad Murtada Abdullahi from Niger State. The issue of, I want to start by thanking the organizers of this great capacity building, and this is a very commendable. The issue of this disability, people with disability, and also gender-based violence. One of the major aspects, one of the major challenge is funding. There are a lot of cases that sometimes you have to follow up, but due to issue of funding, maybe you see some cases have to just be abandoned. And also stigmatization. You know, most of the people that are being victims, sometimes you see they don't want to appear, they don't want to be out. The cases will be follow up, but because of the what's it called? Because of the issue of they don't want to show. And the doctors, they are not well trained. Some doctors are not well trained, while some are not willing to do this, because right now there is a case that we are following up in Niger State with the Office of the Gender Office, the CID, which they've been working. They've been going to almost 3 hospitals, but all the doctors are saying they are saying the doctors are not available. Doctors are not available. Then the facilities, most of these facilities in Niger State, we have the Sakra Yua, which is in the police clinic, and all these the facilities and also the signage. Most of these are not on ground. So the centered thing is, if there is funding, all these things can be available. And also the people that will be translating all this with people that are not hearing, and also there are those that cannot walk. All those things can also be put in place. Thank you.
Thank you very much, sir. For your key reflection, funding is a major gap that every one of us we're actually experiencing. So I would like to move to Dr. from Kano. Sir. Okay. Yes, sir.
Because this issue of especially raping, there is one thing that mostly they used to forget about these drugs and substance abuse, which lead to all this attitude. So please, if there is a way that mostly should be put together so that this issue can also be addressed, because a sensible human being cannot do all those things. Drug and substance abuse is the key driver to all these issues. Thank you.
Okay, thank you very much. So I think I would like to reiterate again that we want to hear key reflections from your intervention, organization-based, what you are doing around inclusion of persons with disability. Have you helped persons with disability seek justice when it comes to GBV, your response and referral pathway? Thank you. So please let me pass it to Dr. Nasir from Kano.
Good morning once again.
Good morning, sir.
Thank you for the organizers. My name is Dr. Nasir Ahmed Garko. I'm the Center Manager, Waraka Sexual Assault Referral Center in Kano. So I am starting with the little introduction of the center. The center was established in November 2016 with the assistance of 3 ministries. We have the Ministry of Health, Ministry of Women Affairs and Social Development, then the Ministry of Justice. So the Ministry of Women Health provide the space for the center and the doctors and nurses, while the Ministry of Women Affairs provide the counselors. They are the one responsible for counseling the client and their parent, while the Ministry of Justice take part in the legal action. After the case was finished from the center, then we refer to the Ministry of Justice. So our main activities at the center is to provide, to attend cases of sexual and gender-based violence, including people with disabilities. We also conduct laboratory service, and where the need for surgical intervention is, we refer to the main side of the hospital. So for the main purpose of the conference is regarding the people with disabilities. We have attended many cases of people with disabilities. However, our main challenges that we are facing is that we have little or no facilities for people with disabilities in our center. We have only, what I can say is we have only, maybe we can say we have a wheelchair for the center. Otherwise, we have nothing than this one. So I don't know at the end of the program, how are we going to do with our center if we compare with the displayed recommendation, comparing the Lagos and Abuja. They don't have all, they have little about these facilities for people with recommendation. If you look at our offices, I don't know how we are going to do after the conference, whether we are going to reconstruct or we have to move to another site. Thank you.
Thank you so much, sir. Thank you, sir. So I would like to move to Kaduna State.
Good morning once more. I am Nana Kandam. For the SACs in Kaduna, we have 4 different centers. And what we do is we offer psychosocial support, free medical services to survivors of survivors, that's people living with disabilities. But from our experience, what we've noticed is, first of all, looking at the reports, if you look at the facilities in terms of the ramps, the structure, all of those accessibility for the survivors, honestly, it's something that we do not have at the centers. What we have tried to do is another thing. We don't have people who can interpret. We don't have the Braille and all of that. But most times when we have survivors, they usually come with caregivers who interpret what they are trying to say. For those with the speaking impairments, that's how we've been attending to them, providing services to them. And another thing we've tried to do is to work with there's a disability rehabilitation board in the state. You know, we've tried to collaborate with them. If there are survivors, you can please refer them so that they can have access to the services in the center. However, we've also noticed that most of survivors, people living with disabilities, it's few of them,
usually get to the center. We know that from statistics, a lot of them are experience assault, GBV, and all of that. But then, if you check the centers, very few of them actually get to the centers. And then another gap that we noticed is, or another gap that we had, I think until 2 months ago, even in our documentation, there was no place, we would attend to them, but if you're looking at our data, there's no disaggregation that states this person is a person that is living with disability. So these are some of the challenges that we have in attending to them, and we're glad that we're learning, you know. And then, of course, one of the things that we are hoping would help is we've noticed that if the government is responsive when we take these learnings home, it is because our centers are government-owned centers. So it's, if the government is responsive, at least they would help to provide the necessary facilities that will help accessibility to survivors. So this is my experience so far. Thank you.
All right, thank you so much, Mara. And lastly, I'll call on the Miss Mercy from Moremi Clinic, Ekiti State, to give us a reflection.
Good morning, everyone. Good morning. I'm very sorry I'm sitting. I have stage fright, so Ekiti SAC, Ekiti Sexual Assault Referral Center, is located inside the Ekiti State University Teaching Hospital. Our facility is very accessible to people with disability, because whenever there is a case, we have an interpreter that the government provides for us to help interpret whatever it is we are saying to a deaf person. I'm very sorry I used that. And then we have a ramp where wheelchair can go in freely. We also partner with Ekiti JONAPWD and Disability Unit of NSCDC to respond to persons with disabilities. And our intervention, since Ekiti SAC was established in 2020, we have responded to about 19 disabilities clients comprised of the blind, deaf, mental, and physical disabilities. We intervened in a case where a stepfather and his son who sexually assaulted a deaf girl have been convicted and sentenced to prison. The girl was in school of the deaf. We withdrew her from the abusive home into government shelter, transit home, where she now stays during holiday, and she has finished her secondary school and she's preparing to write her JAMB. Okay. The policy that our facility have in support of people with disabilities, we have Ekiti GBV law in 2019 that prevents and responds to gender-based violence for everyone in Ekiti State, men and women, including people with disabilities. The chairperson of the GBV committee is the First Lady of Ekiti State, and members include stakeholders like Ministry of Women Affairs, Ministry of Justice, Health, Education, Police, NSCDC, SAC, Judiciary, House of Assembly, and NGOs. We also have Ekiti State Disability Law 2020, which prohibits discrimination against persons with disabilities and mandates that all public buildings in Ekiti State can be accessible to people with disabilities. Thank you.
All right, thank you so much. Thank you to everyone from the unaudited states, that's Kogi, Benue, Niger, Kano, Kaduna and Ekiti State. We really appreciate your reflection, and we hope that all of this gap that we have identified right now, by the end of this training, we'll be able to provide an actionable solution to all of those gaps. And to everyone, I want to say thank you again. And I would also like to say that I said earlier that we have a coalition of disability inclusive GBV respondents, which comprises of people from Lagos and Abuja earlier. We are going to expand the group, and also to say that this coalition actually is not just there to respond to GBV cases against women and girls with disability alone, but also to support us in conducting advocacy visits to various government stakeholders, government agency. When you talk about NAPTIP, you talk about Ministry of Women Affairs, we talk about human rights commissions, so as to ensure that this training does not just end with JONAPWD, this project does not end with us, but also actually has the sustainable impact that we were hoping to get. And then from our previous conference and this one, I think I would also like to reiterate that partnership and coordination is actually central to all that we do. And why we have everyone in the room with different expertise is to ensure that we're actually collaborating to sustain the outcome from the accessibility audit, and then ensure that we are making our intervention disability inclusive. So thank you very much. Before I close this session, we'll be going for a tea break right after now. But then, before we go, oh, sorry. Okay. Response.
All right. Good morning once again. I just want to correct a notion. I've heard 2 to 3 persons talk about persons living with disability, persons living with disability. We prefer to be called persons with disability, not persons living with disability. Thank you.
Thank you very much for intimating us about what you're doing in your state, which is very good. But I've heard like there are gaps, and I think there is need for us to talk about it. The first one is, I had a lot of saying in, from the conversation about your collaboration with Ministry of Justice, with the police and all of those stakeholders. That is very important, because this very important issue cannot be dealt with by one organization. Probably yours is even the first point of call. But the question is, how effective is that collaboration? I am constrained to ask this because I had an experience in Ibadan in December, speaking with, doing a training for judges and stakeholders in the criminal justice sector. And a story was told. I was, actually when I had Ekiti, I was expecting that I would hear that someone is coming from Oyo so that we can talk about that. They told us about cases, not just one, not 2, from the Ministry of Justice, involving people with hearing impairment, with learning disabilities. But the pain in all of that is when the prosecutor said that, oh, they didn't have sign language interpreter. They didn't have anybody that can sign. This person cannot talk. In fact, she's even calling them imbecile. So you can imagine, how can you get intervention from people who don't understand? With due respect to Benue State, sign language interpreters are supposed to be paid. They are expected to be paid. But someone must take responsibility for that. If it is in court, I am a lawyer, and I know that in court we have language interpreters who are paid by the court. So why can't sign language be included as interpreters in the court. Even if it is in the police station, even if it is in your organization, you are paying for other services. Why can't you pay for the service of a sign language interpreter if that is what will will help in resolving that matter? Every stage in this matter, from when the offense is committed, to the investigation, to being in the referral center, to going to court, the justice system, all of it must be accessible. And this comes to the point that accessibility is not about having a ramp or a wheelchair. Accessibility is even about your own services being accessible to the people that you are offering these services to. How are these people aware? I am from Kaduna State. I don't even know about these 4 centers and all of that. So if somebody should call me from Kaduna and say, how informed are people about your services? You know, all of this conversation is for us to be able to come to a point where we can serve people better, where we can do these things and to ensure that justice is meted. And when we are talking about this violence, let's not always limit it to just rape. It's beyond that, and it's good to help people to understand. So please, accessibility in all aspects is very important, whether physical, whether communication, whatever form of accessibility that you can give. Please, if you are working with the Ministry of Justice, help them to understand other organizations. I told the woman, I even collected her number. I said I will look for JONAPWD and other organizations in Oyo State that you can collaborate with. If you have a person with disability who is deaf, you should be able to even do a sign language interpreter within that area, or an organization that can provide one. And when we even talk about the doctors and the hospitals not knowing, not having knowledge or not willing to do it, we should be able to know what we are supposed to do, you know, or insist on doing for them to ensure that they are public servants. And as public servants, they must do their work. So it's just for us to know the right thing to do at the right time. Then using relative as sign language interpreters, please, if as much as possible, let's desist from that. The person may even be the perpetrator. So how would you be able to get proper interpretation from that person? It could be biased. He may not even be telling you something that, since you don't have the knowledge yourself. Please, if we are doing these things, we should do them and ensure that this intervention are done properly. I think I will just leave, since we have conversation going on. The other points can come later. Thank you.
Thank you, ma'am.
Okay, thank you, everyone. My name is Betty Mube. I'm the Vice President of National Association of Persons with Physical Disabilities in Nigeria. I just want to throw a voice to the discussion ongoing. I have keenly listened to all the states made their presentations. 3 things stood out. Most importantly, it is very clear that we still need more capacity building on the aspect of disability inclusivity. When we talk of access, access is not necessarily only sign language, not ramp. When we talk of accessibility, it is in entirety. One, I'm talking from 2 hospices now. I'm talking from FCT Women Affairs, Monday Secretariat, and also Physically Challenged Cluster of JONAPWD. Now, we've done some studies and research has shown that over the year, when we talk of location of such centers, it is prominent that it must be at a safe, not just accessible, a safe location where these victims are kept, the survivors are kept, and the perpetrators can reach them. It's just like, for those of us in Abuja, like say for instance, this victim was raped in Maraba, and you also kept her in a SAC center in Maraba. The person will also access her. Safety is also accessibility, very paramount, the safety of the survivor. So the location matters. So oftentimes we should deliberate about the location of our SAC centers. Then every other accessibility needs can come in. It's only when the person is safe that you can think of other services. 2, I heard the Niger mention funding. Niger, funding is no longer trending. The whole funding organizations are backing away from Nigeria and from Africa. So we have also been taught to leverage on each other's competency, area of specialty to work. How does this work? If you're in Niger State and you have other sex centers, you have NGOs that work in the same space, there are pro bonos, there are still sign language interpreters who work as pro bonos. Yes, I am able to say this. Disability Commission can offer that. There are other commissions in your state who have sign language interpreters as their staff. So if there is a synergy between you and the Commission on the Person with Disability, they can offer that service. Yes, those services are highly paid for because it's also a profession. But for you to access a pro bono service, you must also have an affiliate, a strong synergy with the commission in your state and other organizations of persons with disabilities who can also offer you these services. So oftentimes we use this as an excuse. So, sir, from Niger, funding is very far from Africa. So we make use of what we have to get what we want by synergizing with other organizations who are working in the same space with you. Let's say there is a victim that has been raped and she needs medical attention. I do not have money. How do you take this person to the hospital? It's for you to reach out to other organizations. There is an emergency here. There are some organizations that have medical personnel working with them who can also take other aspects. You are leveraging on the competency and the synergy you benefit from synergizing with other organizations. So we all have different areas of specialties. By the time you're coming together to work together as a body responding to one issue, you will leverage on each other's capability to salvage the situation. Thank you.
Thank you, ma'am.
All right, my name is Comfort, and I have a question. So my question is, how do people access these safe centers? I know they already said referrals and all that. So let's look at the victims themselves. We know that there are some people that lives even with their parents but cannot express some intimate issues with their parents. And for some persons with disabilities, maybe their caregivers might even be the perpetrators. And you cannot even tell them, oh, I need help. You can't even go out of the house without that same person aiding you. So how do these people even get to access these safe centers? I met a young lady in Germany last year and we became friends. So we were just talking and she told me her experience. She was raped multiple times and her first rape was at age 8. And it continues because her father was a pastor and they have like a lot of people, pastors coming to the house, and they were raping her. And she could not speak to her parents because, you know, this gap that our parents gives, especially, you know, our parents, not these children of these days. There's a lot of things we cannot, even if a guy asks you out, you can't even say it. It might even be an offense. So she could not even speak with her parents. And even going to the school, because she was in primary school, she started, you know, behaving weird, and they started tagging her winch in her school. So she was even removed from that school because she was behaving absurd, and they said she was a witch. So you could see a lot of traumas this girl had to deal with. And as I speak to you till today, she's an adult. She cannot have a safe sexual intercourse because of the trauma. When a man touches her, she starts, you know, she starts behaving like the trauma comes back. And she'll start behaving, the man would even be afraid of her. She said she almost even got married. But when the man tried touching her, it broke the marriage and everything. So till today, she's still living with that trauma. So I'm just speaking on behalf of people like that. How do they access the centers? Do you people have a way of trying to go, you know, go to primary school, speak to children, go to secondary school, speak to people, you know? They might be able to confide in you rather than confiding in their teachers or their parents because of this gap that we have. Thank you.
Can I attempt answering that? All right, thank you very much. The existence of the Sexual Assaults Referral Center, in the first place, it includes you going out for sensitization and awareness creation in schools, organizations. For Benue State, we're trying to, outside going to school physically and talking to the children about the importance of speaking up and the danger of keeping silent. We're trying to also put in suggestion boxes in schools in such a way that we realize sometimes even the teachers you say go and report to can be perpetrators. So we try to see how outside that, if they don't feel safe talking to teachers, they can just scribble something and drop in the suggestion box, and we check it weekly or from time to time. Now, we also speak to organizations. Every organization is expected to have like a gender officer, where, of course, for adults, where you can make complaints and reports. And majorly for us, let me not speak for other centers, we engage in a lot of school sensitization because we can't go to homes. We engage communities too, but most times you go to the communities, you meet women, the children have gone to school, so we intercept with them in schools and we talk to them.
Okay, so I said it's good you have sensitizations, but you may sensitize people and the child might even, have the awareness and want to speak. So apart from sensitization, like, do you have like a one-on-one peer section, like that you speak to the children, that they can come and speak to you?
Let me add my contribution to that. For us, we don't just sensitize. After speaking to the children, we let them write their questions down. And we have a section outside, like a counseling. We'll have a table where you can come, sit with us and have a one-on-one with us. Pick up, if you can't, of course, there are some children who are too shy to even talk within where the activity, the sensitization is going on. Some can't even come to meet you, they will prefer to write it down. They write it anonymously, ask questions anonymously, and we answer. But again, like I said, it's never enough. We just keep broadening and making reach out, we expand our reach out and all of that. Thank you.
Thank you all for your contribution. At Checheyara, we've been able to mitigate this issue because of our confidentiality policy and safe space reporting. We've been able to develop the very first children's telecommunications platform, a child helpline, a toll-free number 0800 801, where children can receive professional counseling, information, emergency interventions, and referral pathways. Adults also call us. And then we also have a WhatsApp number, because oftentimes you see a child say, I'm physically challenged, I'm hiding behind the curtain, so that they send WhatsApp messages. And the WhatsApp message platform is also for evidence collection, evidence gathering. Say, I'm a neighbor, if they get to know, they'll turn the residents association against me, this and that. Then we go to schools. I can identify with the case of a child that the father is a pastor because of the religious phobia. He is too busy, and we live a negative sociocultural norms that adults are believed more than children. Say, well, how can you say they molest you with your small penis? Well, you've not even grown breasts. Even when I'm a lawyer, when you are going to court, you will see the mother of the child. But when you get to court, tell them you lied to the police. Is it because of you, small girl, your father will now go to prison, your grandfather will go to prison? Who will be feeding us? It's happening, and it's red. So when we go to schools, we let the children know their rights. And also we are sensitive in reading the room. Because child sexual abuse is a monster. With a dragon, with many tentacles. You let them know they can call you. And there are instances when I'm facilitating training, I tell the teachers, school staff, please leave this room for us. I left a public school one day as the school official said bye-bye to me. We had a wonderful time, a lot of disclosures. As I was about to step into the vehicle by the gate, I saw 3 teenage girls. They said, Madam, you are the one we're waiting for. As soon as they bent down to be sure the teacher was not saying, he said, please, let's enter the office bus. I don't want the teachers to know we are reporting. And two of them said, my friend has a problem. You need to help her. We don't trust the teachers. She's the mother is a single parent. She borrowed money from one man for a business. The business didn't work out, and every morning this man will come to embarrass her, pay me. She will kneel down, she will beg. I was duped, I don't have the money. I don't have any plot of land to sell. Then the man looked at her daughter. How can you have a beautiful girl like this and you are saying you don't have anything to pay? The mother said, I don't understand. I said, if you look at her, she's really beautiful, 13, 14. But, you know. He said, allow me to be sleeping with this girl till I'm satisfied. Then I'll forgo the debt. I said, what did your mother say? He said, the mother was kneeling down. My daughter, please help me pay this debt. I said, why didn't you tell your teachers? Then the other girl said, we can't tell them that when she was also a victim. When she was molested, she was on her way to the staff room. She heard the teachers gossiping about another victim openly in the staff room. She had to make a U-turn. I got angry. I had to give her my personal number. Anytime that man comes around again, forget about your mother this time around. I'll personally come with the police. I won't send my foot soldiers. It's that bad. Children bear these problems alone, and for older teenage students, we do interactive sessions, and they will tell you what you don't even know. We'll tell them, just write it down on a piece of paper anonymously. Come and even telling us this December, I was shocked. He said, you know, there are some online games wherein they teach us how to kill and to steal. Yeah, technology based, yes. Where they teach them all this. But then there are a category of children living with disabilities that I don't know what we can do about them. I've seen teenage girls with cerebral palsy molested, but the medical evidence does not connect with the perpetrator. The child does not have a speech. Some are visual, they are living with they have visual disabilities. So those categories, we need more professionals. And I want to say something in closing. We've done so well. I've attended a number of JONAPWD training. We need a directory of all professionals concerned adults here. I'm in Lagos, so we have our team here in Abuja. I've heard from Benue State, I've heard from Kogi. So if I have that directory, I can't go physically to Kogi, I can't go to Niger, I can't go to Ekiti. Then I can call you, I was at this conference, we have a case here, can you please help us? Then professionalism is key. I was annoyed one day, we had a case from Ondo State. The social worker that was supposed to rescue the girl with disability, she was so emotional. When the perpetrator tried to escape, he was running. She joined the police to chase him so that he won't escape. By the time they came back, a family member had kidnapped the victim so that the case will not be prosecuted. So I said, why are you there? And the boss was shouting, upon all the training I'm giving you, what's your own? You are supposed to take the child to the shelter. I said, I didn't want him to run away. You are not police now. What's your own? Thank you. I'm coming.
Morning once again, it's me again. So, okay, it's me, Ave. I'm just curious. For those working in the space, there is something that has been bothering me. I don't know if you have been able to get to know from the survivors what their perpetrators always tell them to make them so scared not to speak out. Because I'm speaking out of experience. My family member, who is so dear to me, is also a survivor. And the fact that we are being able to bring her out, till today I am working on getting her to tell me what this person, her husband, used to scare her to go through whatever she went through. And up till now, she have not said anything. So those of you in this space, is there a way, have any survivor told you what they were using to scare he or she not to say anything? If you say this, this will happen and all.
Okay, good afternoon, good morning, everyone. I remain Dr. Chinemerem Iwanyan, and I want to start with saying thank you so much to JONAPWD for what they are doing in raising awareness and also building capacity for people to respond appropriately to persons with disability and the issues that surround them. Because I will always say it's being a person with disability is naturally traumatizing. Then let's not talk about the indifference from people around you. Let's not talk about the dealings with even the people who are supposed to be your support structure, your family. Then the issue with society, even recognizing that you exist, that you are a human being, and just like they wake up and have needs, you also have your own needs. So it's a whole lot. So with regards to the question that was just asked, which made me raise my hand very keenly, is the vulnerability of the victim that the perpetrator targets. They are very manipulative, they are very observant, and they are very intelligent. I think the issue with doing evil comes with a level of intelligence. So they observe to know, what is it that I can use against this person? To one, we had a case where the woman is being molested by the husband, but it didn't end there. The husband is also molesting the 4-year-old child. And now, the husband has seen that she needs this marriage. It's like the marriage is her life wire. The husband quickly called the family, his family, to say they should warn the wife that she's busy carrying his name around, saying all manner of nonsense, that if she wants to be in this marriage, she should retrace her steps. This is a woman who has been going around crying to save her 4-year-old daughter, who the husband has been defiling almost every now and then. So, when you talk about what happens, maybe she's finding it difficult to talk to you because what the perpetrator is using against her could be something so dear to her that even telling you means she coming naked before you, and it's not something she wants to do. So there are a lot of factors that surrounds what happens, how they manage to successfully keep the victim under their control. That's one. Then, regarding what Barrister said concerning the reflection from the states and the issues that has to do with interpreters being available and being paid, this is all I have to say. Before I came for the conference, we have a facility. SDF has a rehabilitation home. So at the conference, when the presentation on the different disabilities and how to engage meaningfully with them, when it was done, I started feeling guilty. The guilt here was, these people even need these services we offer more than the normal person, the person we see as not with disability, even though all of us have one disability or the other. So I was interested in knowing how do we engage with them meaningfully. And this is the same plight. This is the same plight of a lot of us. Some of us don't even realize that persons with disability have their special needs. That's the truth. So I will encourage JONAPWD and every other collaborating partner to please continue. We need to go deeper in creating awareness. Every sector of the society needs to understand this and know it for true that this is, in fact, it's even so bad that the person with disability themselves, these special needs we are talking about, a lot of them have, gone beyond going after those needs. They are after what comes forward to what you will give them after you are done talking. So that means they themselves needs a level of sensitization to know what to demand when they engage. Then the people that are offering services also needs to understand that these people have special needs and they have a right to it. Thank you.
Thank you very much.
Please, just in 1 minute, for you to understand the core thing, it's just about the S letters. Let me just read it out. The stigma, the silence, the shame, the silent sobbing, the social status, and stomach infrastructure. Thank you.
Thank you so much, Ma. So I know we still have a lot. Please, Ma. We can continue.
I think we need awareness to let people know living with disability does not mean you are less a human being. There's a place in Lagos where people go and defile ladies with disabilities and the victim will pay them. They call it sympathy fork. They'll say, as you have, which man want to marry you, look at you, this and that. And they'll make even the victim feel you are now a human being after. I saw a girl come out. She was so physically disabled that she literally crossed on the ground and she was heavy, pregnant. And she said, they told her, even family members said, this one you see, all your life you've been living with disability, no man has approached you. So we need a reorientation. We need to shift the mindset. The little money she has, and she has to be paying each time this guy sleeps with her. Thank you.
Okay. Maybe when we come back from the break, we can also continue the conversation. Thank you very much, everyone. We have actually laid the background to the training that we wanted to go through today. But before we go for tea break, I would like us to know that we would please request that we all march outside where the backdrop is for us to take the group pictures while it's still fresh. But before we march outside, a QR code will be projected right now on the screen. It's the QR code to the pre-training assessment. We would like us right now take 5 minutes to scan the QR code and fill in the Google form. And right after that, we'll go outside for the group pictures before we embark on the tea break. Thank you so much. Please let us all bring out our phones and scan the QR code. Okay, so please, if you have challenges accessing the QR code, do let us know so that we can share a direct link.